Hello, I'm Dr. Poornima, one of the consultant in OBGYN department in Aster RV, JP Nagar branch. Today, I'm going to talk a rather grim topic, obesity in infertility and the same in pregnancy. So what is obesity? Someone with a higher body mass index, which is calculated as weight by height ratio, is BMI. And if this is on the higher side, about 23 in the Asian population or about 25 in the Western population, someone is considered as obese. Now, coming to this, with the rising prevalence of obesity, it's a growing concern, as one of Alison Prue's article saying that the overlooked role of obesity in infertility and pregnancy. We do not give importance to obesity at all. Why? Why is that so? We do not know the implications or the consequences of this. Types of obesity. Class 1, anyone having a BMI about 30. Class 2, anyone having a BMI of about 35. And class 3 obesity, anyone having a BMI above 40, which is otherwise morbidly obese. If they have comorbid factors like hypertension, diabetes, then that is also considered serious even if it is class 2. Now, when a woman comes at inability to conceive, even after trying off for 1 year of unprotected intercourse, where the husband's semen sample being normal, analysis being normal, and she's on the higher weight, even a 5% decrease in her body weight would add weight or increase her fertility chances. This, by reducing the body fat, she would increase her chance of a good ovulation. Many of the obese women who are having a higher body mass index have irregular cycles, anovulatory periods, or other associated conditions, comorbid conditions like hypertension or diabetes or thyroid-related disorders. Coming to the difficulties faced when we deal with obese couple or a obese woman. Starting from the basic investigations, whether to prick them to get a venous line or even to do a simple ultrasound, gets difficult when there's a lot of excess body fat in the body. So there's a lot of visceral adiposity, that is fat sitting on the organs. So the clarity is decreased, the depth of vision decreases. This is one of the main concerns when body imaging is seen with obese women. And coming to the treatment part, every treatment is based on the weight. So sometimes the dose might not be enough. Starting in our ovulation induction cycles, the amount of medicines that we give sometimes depends on the body mass index. So the higher the weight, the higher the dose, and the higher the side effects as well. And of course, higher the cost, as we know these days how expensive these treatments are. Statistics has shown that in obese women, the pregnancy rate is decreased, the clinical pregnancy rate, the miscarriage rate is increased, and also the cumulative live birth rate is decreased. All this is because of the oocyte quality. This is because the excess body fat sometimes secrete estrogens, and this has an effect on the oocyte quality. So all in all, obesity in infertility is a growing concern. So the treatment strategies are, if the woman is overweight or in class 1 obesity, the strategies are weight reduction program, which includes a healthy lifestyle, diet and exercise, which is tailor-made to the individual. Either she can go into an exercise program of 15 to 30 minutes a day of moderate intensity or a high intensity exercise, and diet which contains a proteinaceous food and less on carbohydrates and fat intake, and a lower total calorie intake. All this would help her to reduce her weight. There should not be a drastic weight loss, as this could be injurious to health. Now coming to the higher class obesity like class 3 and class 4. Sometimes in class 3, along with comorbid conditions like hypertension, diabetes, we sometimes do offer bariatric surgeries as well. And anyone with no comorbid condition but class 3 obesity where the BMI is more than 40, we refer them to a bariatric specialist where bariatric surgery might be indicated. And then when these women undergo a bariatric surgery and there's a weight reduction, we do allow conception after 18 to 24 months after the surgery. So as we see, obesity is rising and it's becoming a widespread and a growing concern. We in Aster will help you if you are finding a problem in conceiving. And we here as a multidisciplinary team will help you out in tackling your problem. And we will give individualized comprehensive care to each and one of you. Thank you.